What AyniMed is today is in his unknown.
Tragedies like this happen globally. Every minute, 5 lives are lost to poor healthcare and delays in emergency care. 4 out of 10 patients suffer irreparable damage in the ambulance. Hospitals don't know the patient's vital signs and symptoms during transport. They don't know what equipment to prepare, and this essential time can cost the person's life.
This is the Bernard Countryside Health Center in Piura, 40 kilometers from the city. Currently, 20 minutes are lost just in transfer paperwork.
Then, the patient travels for an hour alone, with only saline solution and a nebulizer. On the highway, nothing is known about the patient. Finally, upon arriving surely at the hospital, 15 crucial minutes are lost preparing the emergency room. What if there were a digital ecosystem that mapped out ambulances and knew everything about the patient? You don't need to imagine what it will be like. AyniMed connects all ambulances with a one hospital support system.
We integrate vital signs, monitoring, and real-time communication during emergency.
Our platform automates emergency paperwork and reduces initial response time to 0. No equipment in the ambulance, with our smart and compact armband, we track vital signs. Hours of medical equipment in one all-in-one medical dispositive. Using satellite communication, we transmit health status and symptoms even from remote areas without Wi-Fi.
AyniAI, our predictive AI, analyzes the armband data to forecast the patient's rate of deterioration. 15 minutes before arrival, the destination hospital receives alert by AyniAI, indicating exactly which equipment to prepare.
Unlike current alternatives, which rely on disconnected paper records or simple radio calls, AyniMed keeps patient, ambulance, and hospital connected in real time.
At the time, we test AyniMed by monitoring 50 people at this hospital and this clinic.
Our system demonstrates a 100% reduction in emergency rooms response times and complete communication even in the most remote areas.
Sería de gran ayuda tanto para el personal que está en la ambulancia como para el personal médico para poder dar alerta.
Sería muy útil porque imagínate, tú estás en el situ viendo al paciente, tomándole los signos vitales.
We are working in the mechanics and electronics laboratories of the University of Piura with the highest international standards from Europe.
In Latin America alone, more than 8,800 centers lack technology. In Peru, that represents 85% of all facilities. Our target is hospitals that receive countryside transfers. Our system is unique, it's accessible, scalable, and highly traceable.
Implementation of Monitor Armband costs $500 and $680 to install the receiving server at the hospital. The starting price for hospitals and health centers is $1,400. To ensure financial sustainability, we charge a monthly subscription of $200 for support and data management.
AyniMed's impact goes beyond technology. It's about transforming global health and well-being. We are making the difference between life and death. We are closing historical gaps so that anyone, no matter how remote their community is, all can access to world-class care. With AyniMed, everyone can have equitable, high-quality care.
Implementing our system on a large scale could save 60 million lives and increase life expectancy by 3.7 years by 2030.
Renzo became an organ donor, a hero to 4 people, but I would have loved to tell him what we are building, so that there are no more stories like Renzo's.
With AyniMed, we leave behind the phrase, "Everything that could be done was done," because now we can do more. We are AyniMed, and we are gaining the minutes that saving lives.